Why we have so many cases of autism, so many cases of attention deficit hyperactivity, so many issues with our kids. And one thing that has been suggested is if we're not thinking, or studies are not showing that it's vaccines or that it's cell phones, or, although some studies are suggesting, but that's a whole nother story for a different day, then maybe there's something happening to kids in the womb. Is there something we're doing different decades later that we did from previous generations that could be now affecting kids? Why do we have 1 in 36 kids on the autism spectrum? Why do we have rising cases of attention deficit hyperactivity disorder? Why do we have increase in prematurity, increase in childhood obesity, childhood diabetes? Is there something happening fetally? Well, we do a lot now with maternal fetal medicine, thank God. We have ultrasounds that can examine the babies. We have ways to treat moms when they are suffering, like hyperemesis gravidarum, where they are vomiting so much that sometimes they need IV fluids and supplemental hydration. Luckily, my nausea vomiting wasn't that bad. I actually used some homeopathic Ipecac. My family medicine doctor partner in my clinic had said, why don't you get some Ipecac? And that worked amazingly. And I only had to take 1 dose and my nausea went away. So I'm a big fan of homeopathy. But when it pertains to a pregnant person, we have to be very, very careful, because whatever we take affects baby. And I know there's a lot of debate where people don't think the fetus is alive. It is a live entity. And so we do have to understand that whatever a pregnant woman takes or does can affect the fetus or eventually the baby. So one thing that has been done very commonly is, give mom a list of medicines that are safe during pregnancy. And when I was delivering babies and when I was in training and taking care of patients, Tylenol or acetaminophen was one of the drugs that was considered completely safe. In fact, they changed the category rating, but at first it was a category A. And just to quickly review the category A's of pregnancy categories. Category A shows that there have been no risk to fetus, no concern, it's relatively safe. Category B is where animal studies are not showing a risk to animal fetuses, but this was not necessarily confirmed in human studies. Or category B, there were some side effects in animals, but we really couldn't confirm that for humans. Category C is where animal studies have shown adverse effects to fetus, and so we're, as a precaution, not going to be using it in humans, especially if we don't have studies. So we're going to play it safe, make it a category C. Category D is where we know there's human fetal risk. And you might, if mom is in dire straits, there might have to be a decision of benefits versus risks, but we really like to avoid category D. And the category X, absolutely not. Like Accutane, we don't use category X's because we have a lot of evidence showing those medications can hurt a fetus. And so Tylenol used to be a category A, and then they changed it. Now, why did they change it? Well, I wrote a piece on this where one study found an increased risk of hyperactivity using acetaminophen or Tylenol-related products. Now, when you're pregnant, you get pain, you get headaches, not a lot you could take. So Tylenol was usually on the list saying it's relatively safe, but a study found an increased risk of attention deficit. Another study expressed concern on the fetal kidneys and used caution with its use. Then another study a few years back, published in Nature Reviews Endocrinology, found increased fetal risk of neurodevelopmental, reproductive, and urogenital disorders if mom used acetaminophen during pregnancy, and urged patients to minimize exposure. Now, this study came out in 2021. A quote from it is, "We recommend that pregnant women should be cautioned at the beginning of pregnancy to forego using acetaminophen unless its use is medically indicated. Consult with a physician or pharmacist if they're uncertain whether use is indicated, and before using on a long-term basis, and minimize exposure by using the lowest effective dose for the shortest possible time. They say we suggest specific actions to implement these recommendations. So now we have another study looking at attention deficit hyperactivity disorder with acetaminophen. So this was published in the journal Nature Mental Health. They said compared with no exposure, detection of acetaminophen in maternal blood during pregnancy was linked with 3 times the likelihood of the child developing attention deficit hyperactivity disorder. They looked at samples from 307 black women, according to Fox News, during their second trimester of pregnancy, tested for markers of acetaminophen. They sampled their placenta after delivery to look for signs of increased inflammation in those exposed to it. And then they followed up with the children when they were 8 to 10 years of age to determine how many were diagnosed with ADHD, and then determine whether the prenatal exposure could have played a role. And they did find DNA changes, related to immune system pathways in the placentas that were exposed to acetaminophen, which is linked to a higher chance of ADHD. Now, this is not saying if you take Tylenol or acetaminophen, your kid is going to have attention deficit hyperactivity disorder. The take home of this is everything is a chemical. And I barely took Tylenol. I had headaches. I had migraines. But man, I did showers and cool compresses. I just wanted to take as little as possible. I did take prenatal vitamins, and I did take stool softeners. I had to do that. And then I rubbed this oil. There was a special maternal compound that would prevent stretch marks, and I didn't get stretch marks. My friend Michelle had done it, and she looked great. And she's like, you got it, because she was pregnant at the same time I was. And she had done it for her first pregnancy. And so I used this. I remember the bottle. I forget what it was called, but I didn't get any stretch marks. And it was pretty phenomenal. I just don't know what was in it. And it didn't even smell bad. It smelled kind of nice. But I didn't dye my hair. I was born a blonde, but then the blonde hair fell out, and then I was a brunette. So I am technically a real blonde. It's just I wasn't blonde growing up until I went to the bleach. But I always had been apprehensive about what the fetus could be exposed to. Because when you go back to caveman times, what was the fetus exposed to? Well, fish and nuts and, mom exercising and running around and sleep and weather patterns. It was not red dye 3 or yellow dye 10 or food preservatives or bleach or Clairol or, all of these other things. And so if you have somebody who's in pain and they are, ready to hit medications that are category C, category D, because they're in so much pain, we would then prefer they use something. That would be then category B. But talk to your medical provider. We have been, from, when I was in training since the 90s, saying absolutely, you could take, I remember hearing an OB I was training under tell her pregnant patient that she could take all the Tylenol she wants. No, there's liver toxicity. How do you know? Not to mention some of these acetaminophen tablets have colorings to them. So I don't want to scare pregnant people because it's not easy to be pregnant. I had painful pregnancies. It was not easy. It was rough. Couldn't sleep, and not being able to take anything can sometimes make the matters worse. But understand that everything could pose a certain microscopic, effect on the baby. And so talk to your medical provider first, 1-877